We're now joined by Susan Stephenson-Martin, Director of the Rutgers, New Jersey Medical School, Women, Infants, and Children. That is the WIC, W-I-C program. Good to see you, Susan.
Good afternoon.
Let everybody know as we put up, excuse me, information about WIC. What is WIC and why more important than ever?
So Women is a federally funded program for, as you said, women, infants, and children. And we are a program that supplements nutrition, let's say for low income, or nutrition intervention program for low income women and infants and children, to provide breastfeeding support primarily, but formula supplementation to women in need, and nutrition education and counseling for pregnant moms, and then obviously nutrition intervention for children from 1 through 5.
So, you know, the baby formula shortage, we are in the summer of 2022. We hope that if this program winds up and repeats, it's not as bad as it is now. How does this baby formula shortage and the finger pointing, the blaming, it doesn't solve any problems. More importantly for us, for the people who are disproportionately affected, who are those people and how are they disproportionately affected, those women? Please, Susan.
So these women are women that are under the 185th percentile of poverty. They are—
Define that for everyone so we understand what that means.
The 185th percentile of poverty, meaning that they're below the poverty, they're at 185th% below the poverty level.
They are struggling and challenging to pay their bills and to live their lives and support their families.
Correct. They're also at nutrition risk. So WIC is two-pronged. So not only are they below the poverty level, they are at nutritional risk, both themselves, their infants, or their children. So why this formula shortage affects them disproportionately is obviously, one, you just mentioned, they need this formula supplementation so that they can provide nutrition to their children because they're unable to afford or hopefully afford all of the needs for their children. So this program supplements that need, in another way of saying. In addition, the formula shortage affected the most vulnerable populations because the Abbott Formula Company supplied our specialty formulas for those children that were either having an allergic reaction or had some kind of GI issues. So those children especially needed that special formula. So when Abbott closed, it put a strain on the other formulas that were available for those particular children or infants.
Susan, hold the point right there. Is it a fact that Abbott, that company, had 40+% of the baby formula market in the country?
Well, I don't know their percentage for the country, but I can tell you for WIC, Mead Johnson is our contracted formula. Abbott formula, we sourced that formula for our exempt formula. So those specialty formulas like Alimentum and things like that. So the exact percentage of what they produce for nationwide, but as you can imagine for supply chain, if a huge hub is gone, then it puts taxing on the other manufacturers that are in the field. So even though it didn't affect those manufacturers, now we had more of the population needing those formulas and using that supply.
Okay, so for women watching right now, for families of those women, for friends of those women who hear stories about women trying to figure out what their other options are for their children and starting to make choices about what to mix and what makes sense for their children or not, and they're not pediatricians and who the heck really knows. Question here. As we put up that website, Susan, how could that and should that help people?
That should help people by finding how to return their formula, any recall formula that they may still have. Remember, we've been doing this since February, so hopefully the recall formula has been coming in. Secondly, it should help them be able to find a vendor or a supply manufacturer that they can find the formula that they need. Two, it should also help them with how to feed their children or child safely by not diluting formula, not using formula that's not approved, things like that. And finally, it should also help with any status updates as to what changes there are governmentally or through the WIC program, what waivers are approved and how we are expanding the use of WIC, whether it be now we can use bigger sizes for the formula. So the sizing has grown. Different manufacturers we're trying to get into waivers as possible. So that will keep them updated as to what the changes are. Their physicians could now approve 2 formulas at a time, so they don't have to get doubly approved.
Susan, let me ask you, how much could the state of New Jersey do if they wanted to make policy changes that would improve the baby formula crisis versus a national, international Abbott issue, the federal government regulating and stopping production at Abbott as they did? How much of it can New Jersey influence, control versus, hey, it's much bigger than that?
Well, New Jersey can definitely influence the nation conversation, if you will, or policies that are being instituted, because each state has a WIC program, and those state agencies or state officials do talk to our national level. So we have the Federal Nutrition Service, and they then talk to the USDA. So that communication trickles down, and quite often the state impacts what the policy is going to be because we're boots on the ground. So they're educating at the federal level what's happening at the local level and how those policies can help us at the local level, those changes, I should say.
Susan Stephenson-Martin from the Rutgers Medical School, the director there, Women, Infants, and Children, the WIC program. Incredibly important topic, not going away, this issue and this challenge. We'll have you back again. Susan, thank you so much.
Thank you so much, Steve.
I'm Steve Adubato. Thank you so much for watching. See you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, the Healthcare Foundation of New Jersey, the Turrell Fund, supporting Reimagine Childcare, RWJ Barnabas Health, New Jersey Sharing Network, New Jersey's Clean Energy Program, Valley Bank, the Fidelco Group, and by the Adler Aphasia Center. Promotional support provided by ROINJ and by NJ.com.
Hi, I'm Dr. Sharif Elnahal. Did you know that there are nearly 4,000 New Jerseyans waiting for a life-saving transplant? And 67% of those people are people of color. Just one organ and tissue donor can save 8 lives and enhance the lives of over 75 people. Let's come together to raise awareness in our diverse communities. Donation needs diversity. You have the power to make a difference. For more information or to become an organ and tissue donor, visit www.njsharingnetwork.org.